Well, hello, it's Bruce Williams again, and it's time for Gross Path Challenge number 55. I'm sheltering in place here in Bethesda, Maryland. But yesterday was a great day for me because I got the cast off my foot. So I'm feeling a whole lot better, and I'm going to give everyone a free question to start Gross Path Challenge number 55. This is tissue from me. And I took this yesterday afternoon after the cast came off after 7 weeks. How about a morphologic diagnosis? Well, I don't want to be accused of malpractice, but I see this as diffuse severe cutaneous hyperkeratosis. It's going to give me a couple of days to get all of that scrubbed off. The incisions look pretty good, except for the bottom of this one, which had a little dehiscence, maybe because I was a little too active on that cast. So, are you ready to start the real Gross Path Challenge? Okay, let's begin. Question number 1 is tissue from a calf. Okay, time's up. Well, I started you out with a real easy one, and as long as you can count to 3, you can see that this calf has 3 toes, and that's a condition called polydactyly. And we see occasionally in just about any animal species, cats, especially certain breeds, tend to be predisposed. Maine Coon cats will have them, and there's a special breed of cat known as the American polydactyl. You get a good birth defect, and by gum, somebody's going to make some money off it. So they sell these cats with 6 or 7 toes on the front feet. Okay, slide number 2 is tissue from a turkey. Can you give me a morphologic diagnosis, a cause, and name another affected organ? Okay, time's up. Well, this is a classic picture of infection by Histomonas meleagritis. Okay, these targetoid lesions within the liver are absolutely classic. These are bland areas of necrosis in most birds because they die pretty quickly. Sometimes you will see granulomatous inflammation and multinucleated macrophages if the animal survives for any length of time. Try to go in and clean up the histomonads. These are amoebic-like parasites. When I think of amoeba, most of them secrete powerful exotoxins that act like perforants, and they punch holes in all the cells around them, whether they're inflammatory cells or they're hepatocytes, and they cause a lot of damage. The other organ that is usually affected, it's not in this picture, but it's probably where most of these infections start, are the ceca in the bird. These organisms usually live in the ceca. If there is a disturbance in the bacterial flora, then they will overgrow, they will burrow into the wall, cause a tremendous necrotizing reaction, and when they get into the bloodstream in the wall of the cecum, first thing they're going to do is get into the portal circulation and shoot up into the liver, where they're going to do the same damage. In affected animals, because they're in the blood at this time, you can see them anywhere. You can see them in the lungs, you can see them in the brain. They will cause necrosis, but the concentration of the infection of these animals are going to be in the ceca and the liver. You can see them in other types of poultry as well, but turkeys are well known for them. Question number 3 is tissue from a foal. Can you give me a morphologic diagnosis, the cause, and how about a clinical pathologic finding? Okay, time's up. We're looking at a section of intestine. You can see that there is really severe edema of the lamina propria here, the muscular layers here. Lamina propria is way thicker than it should be. Here's the mucosa. It looks a little bit thickened too. There are areas of hemorrhage in here. I think that might be the result of prosection. And the morphologic diagnosis is a diffuse histiocytic enteritis with severe submucosal edema. The cause of this is Lawsonia intracellulare, and a clinical path abnormality which would be a great one, and one that is used diagnostically in most of these young foals. They're just not, they don't do well. They're skinny, and they have hypoproteinemia. They have tremendous protein loss through the gut. Lawsonia intracellularly affects a wide range of largely mammalian species, first identified in hamsters and pigs back in the 70s. and went through many, many name changes. I've known it in my career by 4 or 5 different names, but it's Lawsonia intracellularly, and it's been intracellularly for probably about 10 or 15 years. So I think we're in pretty good shape. In most animals, it causes a necrotizing ileitis. In some animals, like rabbits and foals, it causes a histiocytic enteritis, most severe in the ileum. And one of the classic lesions is this tremendous submucosal edema. These animals lose so much protein through their gut, they become hyperproteinemic, they can have ascites. But one of the really quick and easy diagnostic tests before you go on to PCR, the feces, is going to be the clinician is going to pull some blood on this animal, and the protein's going to be very low. Lawsonia, they don't have the necrotizing lesion that pigs will have in the gut and hamsters will have in the gut. They have really just this tremendous submucosal edema as the grossly diagnostic feature. Okay, let's move on to slide number 4. This is tissue from a sheep. Can you give me a morphologic diagnosis and a cause? Okay, time's up. Well, it's tough to see exactly what you're looking at. There's a lot of normal tissue left. It's round, but if you've seen this lesion before, you'll recognize it as the chronic active suppurative lymphadenitis. There's your morphologic diagnosis that is seen with Corynebacterium pseudotuberculosis in small ruminants, sheep and goats. In sheep, these lesions tend to be very firm and hard, and they have the appearance of the layers of an onion. It's a classic appearance. And the reason it gets this way is because it starts out usually on the surface, on the skin. It's usually a cutaneous infection. It can be spread from sheep to sheep during shearing because an animal will have a superficial lymph node that's infected. It'll go through a shearing process, and that's a quick process, and there are a lot of little nicks and cuts. And if you cut an area of the skin or lymph node that's infected, then you're going to take those shears and put it into the next animal and transmit it. This is a tough bacterium, and it also will be transmitted in sheep dip tanks. So you shear the animal, it got these little cuts on them, they toss them in a dip tank to get rid of parasites, but this hardy bacterium is going to live in the dip tank, and so the next animal and the next animal and the next animal goes in. All of a sudden, you have a herd that has been infected with Corynebacterium pseudotuberculosis. And for most of them, it's going to remain a superficial cutaneous infection. For about 20%, it will go systemic, and it causes what's known as the thin U syndrome, because the animals that are affected, they sort of don't do well. They have multiple chronically abscessed lymph nodes in their body. And I was going to tell you how this particular lesion happened. It starts out as a fairly simple abscess, but this hardy bacteria is much superior to the body's ability to fight it. So what it does is you have some pus, and then it walls it off, initially with a layer of macrophages, granulation tissue, fibrous connective tissue, and even that is not enough to contain it. So eventually it's going to rupture through that, and then you're going to have another layer of suppuration. Then it's going to get walled off, and then it's going to break through that. And we have these multiple layers of suppuration, granulation tissue, fibrous connective tissue, suppuration, just keeps breaking through until eventually it effaces the wall of that bacterium. one of the problems in these animals is that if it affects the hilar lymph nodes, the ones around the carina, they can get so big and hard to cause asphyxiation of animals. So this is Carinobacterium pseudotuberculosis. In sheep, they're hard, they're firm, and they cause these onion-shaped lesions. In goats, they tend to be ooey gooey and look very different, and they don't have this classic lesion. Slide number 5 is tissue from a cat. Can I have a morphologic diagnosis and a cause? Okay, time's up. We're looking at a somewhat ragtag, moth-eaten looking kidney from a cat. But the classic lesion, or the one that certainly should draw your eye, is this greenish necrosis, which is seen in the renal pelvis. And the morphologic diagnosis that I'm going to give this is focally extensive or diffuse renal pelvic necrosis. Some people say necrotizing papillitis. That's fine too, but it's a necrotizing lesion. This is not pyelonephritis, even though there is discoloration of the kidneys. Now, this is a classic lesion of horses. We all know that it is associated with nonsteroidal anti-inflammatories, and it can be in cats too. This lesion is very well known with certain types of nonsteroidals like acetaminophen, but most of them will do it. And the mechanism behind that is that all of these nonsteroidal anti-inflammatory they inhibit COX-2, and they diminish the production of prostaglandin. And the vasorecta, especially deep in the medulla, are very dependent upon a constant liberation of prostaglandins from the interstitial cells. And when you shut that down, those wimpy blood vessels, the wimpiest in all of the body, slam shut. You can even, if you listen real carefully, you might hear them slamming shut, and this area will die off of ischemic necrosis. Now, the animal survives, and it didn't. But if it did, then what's going to happen is it's going to slough all this stuff. It'll go out in the urine, and the animal will end up just with a much wider pelvis. Now, this is not solely the province of nonsteroidal anti-inflammatories, especially in the cat. We don't see that very much. Most people know that it's a poor mix for the cat. But anything that will cause increased pressure within the medulla, such as amyloidosis. Medullary amyloidosis is seen in the Abyssinian and other types of cats. So that will do that. Blockage, urethral blockage, anything that causes increased back pressure will cause increased medullary pressure and then necrosis here. This particular, and I don't have any other information on this, than it was renal papillary necrosis and it was a cat, but these highlights, this granularity, these linear streaks remind me very much of ethylene glycol toxicity. And so that would be enough in association with all of the precipitation of calcium oxalate crystals, which often give you these little reflections in these pictures, these areas of necrosis, maybe sort of fibrosis. That will be enough to raise the pressure enough within the renal medulla to cause this lesion in a cat. So in a cat, don't just think about nonsteroidal anti-inflammatories like you would in a horse, but anything that will raise the pressure in the medulla is going to cause this lesion. Okay, looks like we are halfway through. Slide number 6 is from a dog. Can you give me a morphologic diagnosis and a cause? Well, this one's a little tougher, okay? What we are looking at, we're looking at the inside of the bladder. We're looking at the bladder mucosa. We are probably halfway between the fundus and the trigone. And we're looking at these little white raised nodules with red around them. And these are actually lymphoid follicles. There are several types of cystitis in the dog. Most commonly, they're proliferative. Sometimes they're emphysematous. In this particular case, this is known as lymphoid or lymphofollicular cystitis. And all these are little lymphoid follicles. The cause is chronic bacterial infection. It's chronically antigenic stimulated. This animal may have had stones. Those two tend to go hand in hand, especially if you have alkaline urine. But you can tell most of the cases of cystitis follow either chronic bacterial infection or stone formation or both in the dog. So that's my go-to answer for any form of cystitis that I see. But this is a really nice one. And it's a lymphoid or lymphofollicular cystitis. Okay, slide number 7. Can you give me a morphologic diagnosis? And this is tissue from a pig. This is an absolutely great picture. This is the ileum of a pig, and we have these little proliferative bubbles on the mesenteric or the serosal surface. The morphologic diagnosis is serosal emphysema or mesenteric emphysema in a pig. It is a well-known slaughterhouse finding, doesn't mean anything. Don't know why this happens. Some people say, well, it's Clostridium producing gas because you might find some multinucleate giant cell macrophages around the dilated lymphatics. These are all lymphatics. But it's an incidental finding. Now, some of you probably jumped on this cerebriform appearance to the ileum and wanted to give me necrotizing ileitis or some other form of Lawsoniasis in the pig. But if you look at the intestine of the pig, you can usually tell the ileum because it has the cerebriform appearance, even in health. Okay, so you'll see that. That's how you tell you're in the ileum in a pig. So don't always jump on this as an abnormal finding. Now, if you opened it up and there was a bunch of necrosis and hemorrhage, sure, I would certainly go there. But if you look at this from the outside, I can't tell you that is not a totally normal ileum. So the lesion is here. It's mesenteric emphysema of pigs. Slide number 8 is tissue from a rabbit. How about a morphologic diagnosis? An etiologic diagnosis, gonna go old school, and a cause. Okay, well, this poor, miserable rabbit. Come on, guys, clean out the cage. But this poor miserable, not miserable because of that, but he's miserable because his ears are itching the crap out of him. I'm surprised he doesn't have a bunch of blood on his back feet, but he's been scratching these ears. The morphologic diagnosis is a diffuse bilateral hyperkeratotic and suppurative or heterophilic, since it's a rabbit, otitis externa. Okay, it affects the outer ear. These ears are infected. You smell them, they stink. This animal has the etiologic diagnosis, which is just the agent, and the organ would be sauroptic otitis or otic sauroptiasis. I don't like that one as much. So let's go with sauroptic otitis. And the cause is Sauroptes cuniculi. And this is a sarcoptid mite, which means that everybody, the whole family, lives within the very thickened hyperkeratotic epidermis. The females, which are rather large, they burrow and make caves and tunnels in this thickened epidermis. The males, the nymphs, the eggs, they're all in there. They cause a tremendous pruritic response. These animals just itch and itch and itch. It's easily treated with ivermectin. And the other thing is these animals are usually, the ears are usually infected as well, probably because the animals share a room with poop and pee, and they get it in their feet, and they scarify their ears and infect that. And these are an awful mess. But the good news for this bunny, hopefully, is that it's easily treated with ivermectin. There's an old picture. Might not have had it back then, so might not turn out as well for this bunny. Slide number 9 is tissue from a pig. Can you give me a morphologic diagnosis and a likely sequela? Okay, time's up on this one. And gastric ulceration is a pretty common and a disease that most people know about in pigs. This is the pars esophageal. It's sort of a squared or rectangle area of right around the esophageal entry into the stomach. And this is where all the ulceration occurs. Sometimes you will see just a big clot covering this area, or if that's taken off, you'll see a large ulcerated area, maybe with a hyperplastic edge. But what a lot of people don't know is that before that lesion occurs, you will often see a diffuse hyperkeratosis. So this is focally extensive hyperkeratosis of the pars esophageal in a pig. This is the lesion that you see before the animal ulcers and bleeds and bleeds and bleeds and bleeds. So it starts with hyperkeratosis. It moves on to the ulcer. And so the sequela is going to be gastric ulcer in this pig. Okay, slide number 10, and then we are done for today, is tissue from a cat. Can you give me a morphologic diagnosis and a cause? Okay, this is an absolutely fantastic picture. Williams' rule of red guts. Since I was a young resident, and I taught many residents this, in the dog and the cat, red gut in a dog and a cat, until proven otherwise, we're dealing with a parvovirus. In dogs, it's canine parvovirus, usually type 2. In cats, it's feline Panleukopenia virus, also a parvovirus. They act very similar. They cause necrosis, and especially deep in the crypts. They wipe out the crypts. There is nothing to regenerate the gut. These animals usually die of screaming sepsis. They have a very intermittent covering to the affected areas. They absorb toxins and bacteria straight into the bloodstream, and they die of sepsis, not this particular condition, although it's pretty bad too. Here's another great lesion, and it's from the same thing, but we see the red gut. What I want you to see is I want you to see this fibrin that is sort of gumming everything up. And in the lesser affected areas, there's a very thin layer of fibrin that looks like ground glass. See, this is a nice, I'm not going to say it's healthy, but it's probably the large intestine. And Panleukopenia doesn't really like the large intestine. It stays restricted to the small intestine. But look at this. It's nice and shiny and smooth. And then you look at this part, and it sort of has this ground glass appearance. It's not shiny. It's just this fine fibrin. Then when you get to the area that's really affected, it has these long strands of fibrin gumming it up. And if you ever have to run the gut on a big animal like a cow or a horse, and you really quickly want to look for the affected area, you quickly look and you can feel the rough ones or the parts that have fibrin on them, and that's the one that you really want to take a close look at. So the morphologic diagnosis is a segmental necrohemorrhagic enteritis. Remember when we see hemorrhage, in almost every instance, we're really looking at necrosis. If you told me this was hemorrhagic enteritis, I'm not going to give you full credit. I got to give you half credit because you're missing the big point, that's the necrosis. So train yourself early on. I see hemorrhage, I'm thinking necrosis. Okay, so segmental necrohemorrhagic enteritis, cause feline parvovirus or feline Panleukopenia virus. Name another organ where you might find a lesion. Well, this looks like an adult cat, or at least it's a mature cat, so I'm not going to think about a cerebellar lesion. You can't see cerebellar lesions if the animals are infected in utero or very, very early after gestation. Well, you're not going to see this. You've got to have whatever organ it is, it's going to have cells which are in a particular stage in the cell cycle that parvovirus needs to reproduce. You always have that in the gut because the gut's always turning over. Other tissues that are always turning over that you will see lesions in are going to be the bone marrow. There will be bone marrow hypoplasia or atrophy, possibly trilinear, and the lymph nodes, the lymphoid organs. You will see necrosis within lymphoid organs. Lymph nodes may be small. You'll see white pulp necrosis in the spleen, necrosis in the thymic remnants. So those are the ones, the hematopoietic organs that you want to think about as concurrent lesions associated with feline parvovirus infection. Well, that brings us to the end of Gross Path Challenge number 55. Thanks for joining me. I hope that everyone is safe. I hope that you're doing well in this self-imposed quarantine. Eventually, this is going to be done. We're all going to go back to work. We're going to be happy. We're going to be healthy. And until then, I hope to see you on a very regular basis with more of these Gross Path challenges. Have a good day.